Welcome to Breaking Down Mental Health with Dr. Jones. In these educational videos, Dr. Jones will discuss mental health diagnosis, clinical supervision, using technology in counseling, multiculturalism, and many other topics to help you get a healthy understanding of why mental health is important. Please don't forget to like, subscribe, and hit the notification button if you enjoy these videos.
Welcome to the Deep Dive. Today, we're tackling something really important in mental health care right now. How do we actually manage crises effectively when we're providing therapy remotely?
Yeah, it's such a critical topic. It's definitely not the same as being face-to-face, is it?
Not at all. Those unique challenges of doing this online, providing support during a crisis from a distance, it's complex.
Absolutely. When a client is in crisis and you're miles apart physically, your response has to be incredibly thought through, really well prepared. That distance just adds layers we need to deal with proactively.
Exactly. And that's why we're really getting into the practical telemental health crisis response, a technical training guide by Dr. Michael Jones today. This is going to be our main source.
It's a fantastic resource.
It really is. What makes it so useful, I think, is how Dr. Jones pulled together best practices from, well, all the key professional bodies, the ACA, NBCC, AMHCA, and even the American Telemedicine Association, the ATA.
It synthesizes a lot of crucial guidelines.
Right. So our mission today really is to equip you, our listeners, with the essential knowledge, some actionable strategies, so you feel, hopefully, a bit more prepared, more confident handling these telemental health crises.
And Dr. Jones really hits hard on that preparation piece, doesn't he? Getting ready before anything happens.
Yes, let's start there. Proactive preparation. The guide really emphasizes setting up emergency protocols right away, like before you even have the first proper session.
It might sound basic, but it's fundamental.
So what specific info are we talking about needing right up front?
Okay, so number one, you absolutely need the client's emergency contact information. Who do they want contacted if things get serious?
Makes sense.
And crucially, their current physical location, not just a mailing address, but where they are during sessions. This is key for knowing where to send help.
Right, because they might not be at home.
Exactly. And along with that, you need the local crisis line or the specific emergency services number for their area.
Not just 911 generally, but their local one.
Precisely. And Dr. Jones points out, and you see this echoed in the ethical codes from the ACA, the NBCC, AMHCA, this isn't just, nice to have, it's an ethical requirement.
So it's baked into our ethical duties. And the guide says this has to be part of informed consent.
Absolutely. Clients have to understand why you need this info and exactly how you'd use it to keep them safe in a crisis. It builds trust.
Okay.
And Dr. Jones also makes a great point. This isn't a one-and-done thing.
Right.
You need to check back on this info regularly. People move. Their emergency contacts might change. They might be traveling.
And their local resources would be totally different then.
Totally different. So regular updates are key.
Okay. And I found this really interesting in the guide. Dr. Jones suggests actually rehearsing the emergency plan with the client. Why that extra step? Seems a bit intense, maybe.
Well, it might feel a bit awkward at first, but rehearsing makes it concrete, not just abstract words on a form. It helps the client really grasp what steps might happen.
Okay, I see.
It can actually be empowering for them, knowing what to expect, how they play a role in their own safety planning. And it gives you a chance to clear up any confusion or anxiety they might have about what happens if things escalate. Creates a shared understanding.
That makes a lot of sense, actually. Okay, so moving to another key point from Dr. Jones. Verifying location. At the start of every single session, we got the info up front, why check every time?
Because, like we just said, people move around. Maybe they're at a relative's house. Maybe they're traveling for work.
Right.
If a crisis hits suddenly, knowing their exact current location is non-negotiable for getting help there fast. AMHCA and NBCC guidelines, they all stress this ongoing check.
So it's about immediacy if help is needed.
Exactly. If you have to call emergency services, you need to tell them where the client is right now, not where they were last week.
And the guide flags documenting this location, check in the notes each time.
Yes. Consistent documentation. It protects the client, it protects you, shows you've done your due diligence every single session.
Okay, got it. So proactive prep, check. Location verification, check. Now, let's talk about confidentiality. This feels like a minefield, especially in a crisis, doing this remotely.
It's a huge ethical consideration. Dr. Jones's guide, and again, pulling from ACA, AMHCA, ATA standards, hammers home the need for secure, encrypted platforms.
Like the video conferencing software we use.
Exactly. Those platforms use tech to scramble the data, make it super hard for anyone else to access. That's our main shield for privacy online.
But in a crisis, you might just want to fire off a quick text or email, right? It's fast.
That's the temptation, but the guide strongly advises against it.
Why is that?
Because standard email, SMS texts, they usually lack that end-to-end encryption. They're just not secure enough for sensitive client info, especially during a high-stakes situation.
Okay.
Leaves data vulnerable. Dr. Jones really stresses explaining these limits and risks to clients up front in informed consent so they know how you'll communicate securely and what methods you won't use for crisis stuff.
Setting clear boundaries on communication methods. Makes sense. Okay, now Dr. Jones talks about a really practical tool, the crisis decision tree. What is that exactly?
Think of it like a flowchart, a pre-planned roadmap for responding when things get intense. AMHCA mentions it. NBCC recommends it too. It helps you stay, focused and make clear-headed decisions when the pressure's on.
Like a step-by-step guide for the what-ifs.
Exactly. And Dr. Jones lays out a really clear example in his guide.
Okay, let's walk through that example. Step 1.
First and most critical, identify the immediate risk level. Are we hearing suicidal thoughts? Is there a plan, intent? Or are there threats of harm to someone else? Spotting those red flags is job 1.
Okay, so assess the risk first, then what?
If there's an immediate safety concern, the next step Dr. Jones outlines is, if you can, try to pause the actual therapy part of the session to do a more focused safety assessment.
Okay, shift gears.
All right. Ask direct questions. Get clarity on their situation, their intentions right now. Then the decision tree guides you. Use that emergency contact info they gave you, or if it's serious enough, contact 911 or the equivalent local service in the client's area.
Directly intervene using the local resources.
Yes, to get immediate help on the ground.
And after the immediate danger is managed, what then?
Then comes the crucial follow-up. Dr. Jones emphasizes thorough documentation, everything that happened, the risk level, what you decided, the outcome, and really importantly, following up with supervision or a consultation. We'll touch on that more soon.
Got it. That structured approach sounds incredibly helpful for staying grounded.
Okay, let's shift gears a bit. Another area Dr. Jones covers is understanding legal boundaries. This sounds tricky with telemental health.
It can be, yeah. More complex than people sometimes realize. The ethical codes, NBCC, ACA, ATA, all point out that our legal responsibilities aren't just about the laws where we live and work.
We also have to know and follow the laws in the state or jurisdiction where our client is physically located during the session.
That's a huge point. Give us some example of why that matters so much in a crisis.
Okay, think about duty to warn or mandated reporting.
Right.
The specific rules, what triggers a report for potential harm to others or for child or elder abuse, how you make that report these can differ significantly state by state. What requires a report where you are might not where your client is, or vice versa.
Wow, okay. So you really need to know the rules for their location.
Absolutely, to meet your legal and ethical duties.
And Dr. Jones suggests creating a quick reference document?
Yeah, basically a cheat sheet for the states where you see clients.
Yeah.
Having that key legal info handy, reporting laws, confidentiality exceptions can save critical time and make sure you act correctly when things are moving fast.
Super practical tip. Okay, another vital piece, according to the guide, collaboration. Supervision and consultation.
Yes, vital. AMHCA, ACA guidelines are clear on this. Seeking supervision or consulting with colleagues, especially with high-risk cases, isn't weakness. It's ethical, responsible practice.
Right.
And Dr. Jones stresses documenting these consultations too. Who you talk to, when, what advice you got.
It's not just for getting advice in the moment, though, is it? The guide mentions another role for collaboration.
Exactly. It's also crucial for debriefing after a crisis. Talking it through with a supervisor or peer group helps you process, reflect on what worked, what maybe didn't, and how you can refine your approach for next time. It's that continuous learning piece.
Learning from experience, basically. Okay, documentation keeps coming up. It's like a drumbeat through the guide and the codes. Why is it so central in telemental health crises?
Because it's the bedrock of ethical practice, especially when risk is involved. ACA, NBCC, AMHCA all hit this hard. Your notes need to be accurate, secure, and detailed.
What kind of details are we talking?
Dr. Jones highlights specifics: date, time, the client's verified location for that session, your risk assessment, the decisions you made, the actions you took, and what the outcome was.
And the guide mentions using specific language.
Yes, clear behavioral language. Instead of writing something vague like client seemed very upset, document what they actually said or did. Like, client stated, I want to die.
More objective, factual.
Exactly. Less interpretation, more factual record of the event.
Okay, now we're talking telemental health, so technology, it's not always reliable, is it? Dr. Jones addresses tech disruptions during a crisis. What do we need to think about there?
Oh, yeah, it's a reality we have to plan for. What if the video freezes? What if the call drops right when someone is telling you they're in danger?
Nightmare scenario.
Totally. AMHCA, NBCC, ATA guidelines all say we need backup plans. And Dr. Jones stresses talking about this possibility with clients during informed consent and having agreed upon contingency plans before it happens.
What would a contingency plan look like?
Could be several things. Maybe a designated backup phone number they call immediately if the connection drops. Maybe instructions for switching to an audio-only call or a different secure platform if possible, or even pre-agreed safety steps they'll take on their end if you get cut off while they're at high risk.
So plan for the tech failure before it happens.
Absolutely.
Okay, nearly there. The guide also focuses on cultural responsiveness in crisis. Why is this so critical?
Because culture and systemic factors profoundly shape how people experience crisis, how they express distress, what supports they trust, everything. AMHCA and ACA codes highlight this. We need to be really aware of these influences. Dr. Jones even suggests tools like the cultural formulation interview to help understand how a client's background, their beliefs, their community affects their crisis experience and what help feels right for them.
So definitely not a one-size-fits-all crisis plan.
Definitely not. You have to tailor your response. What's helpful for one person might be completely wrong, even harmful, for someone else based on their cultural context, their values, their support system.
Really important nuance, and that leads nicely to the final point. Training and competence. We need to actually know how to do this stuff, right?
Precisely. NBCC, AMHCA, ACA, we're all clear. Don't dabble in telemental health crisis work unless you're properly trained.
It's a specific skill set.
It really is. Managing crises remotely requires different skills, different awareness than in-person work sometimes. You need specific training.
And Dr. Jones really pushes for ongoing professional development here.
Strongly. Keep learning. Take CE courses specifically on telemental health crisis intervention. Participate in simulations if you can practice, makes a difference. Dr. Jones even suggests creating like a personal crisis response portfolio with your protocols, documentation examples, safety plans. Keep honing those skills.
Wow. Okay, this has been incredibly thorough. So just to recap the big themes from Dr. Jones's guide and the ethical standards, it starts with proactive planning, getting those emergency protocols set up, verifying location every single time is non-negotiable.
And using secure communication only.
Right, having that crisis decision tree or flowchart ready, knowing the legal rules for your client's location, not just yours.
Collaboration through supervision is key, both for support and learning.
Absolutely. And meticulous, objective documentation of everything, planning for tech glitches.
And always being culturally sensitive in your approach.
And finally, committing to ongoing training to stay competent in this specific area.
And that quote from Dr. Jones at the end of his guide really sums it up, doesn't it? You don't rise to the occasion. You fall to the level of your training. Prepare now.
Oof, that hits home.
It's powerful, right? It's
Yeah.
a stark reminder that preparation isn't just, a good idea. It's absolutely fundamental if we're going to ethically and effectively support clients through their toughest moments remotely.
It truly is. So, final thought for you listening, as you reflect on all this, drawing from Dr. Jones' practical advice and those core ethical guidelines, really consider how weaving these strategies proactively into your practice doesn't just reduce risk. It actually deepens your ethical commitment to keeping clients safe in this evolving telemental health world.
Yeah.
Maybe think about your current protocols. Is there one concrete step, just one thing you can do now, based on what we've discussed, to boost your own crisis preparedness for telemental health? Definitely some food for thought. Thanks for joining us for this important deep dive.